Piperazines. Piperazines refer to a group of chemical compounds often used as recreational drugs. They can produce stimulant effects similar to amphetamines and are sometimes found in party pills or legal highs. Synthetic opioids. Synthetic opioids are man-made substances designed to mimic the effects of naturally occurring opiates like morphine or heroin. They are potent painkillers, but carry a high risk of addiction and overdose, contributing to the opioid crisis. LSD. LSD, or lysergic acid diethylamide, is a powerful hallucinogenic drug that alters perception and mood. It's commonly known as acid and can cause profound visual and auditory hallucinations, as well as shifts in consciousness and mood. Glues, gases, and aerosols. Glues, gases, and aerosols are inhalants commonly abused for their intoxicating effects. Found in household products like paint thinner and aerosol sprays, these substances can cause euphoria, hallucinations, and serious health problems when inhaled. Magic mushrooms. Magic mushrooms, or psilocybin mushrooms, contain psychoactive compounds like psilocybin or psilocin. When ingested, they can induce hallucinations, altered perceptions, and spiritual experiences. Alcohol. Alcohol is a legal psychoactive substance found in beverages like beer, wine, and spirits. While moderate consumption may have social and cultural significance, excessive use can lead to addiction, liver damage, and a range of health problems. AMT, alpha-methyltryptamine. AMT is a synthetic psychedelic drug with effects similar to LSD and MDMA. It can cause hallucinations, euphoria, and an altered perception of time and space, but it is less commonly used than other hallucinogens. Benzodiazepines. Benzodiazepines are a class of prescription drugs primarily used to treat anxiety and sleep disorders. They produce sedative effects by enhancing the action of neurotransmitters in the brain and can be highly addictive if misused. Synthetic cannabinoids. Synthetic cannabinoids are man-made chemicals designed to mimic the effects of THC, the active ingredient in cannabis. They are often sprayed onto plant material and sold as synthetic marijuana, but they can cause severe and unpredictable reactions. Amyl nitrate. Amyl nitrate, also known as poppers, is a volatile liquid often inhaled for its brief but intense psychoactive effects. It produces a rush of euphoria and relaxation by dilating blood vessels and increasing heart rate. Anabolic steroids. Anabolic steroids are synthetic variations of the male sex hormone testosterone. They are often abused by athletes and bodybuilders to enhance performance and muscle growth, but can have serious health consequences, including liver damage and infertility. PCP, phencyclidine. PCP is a dissociative drug originally developed as an anesthetic. It can induce hallucinations, delusions, and a sense of detachment from reality, often leading to unpredictable and sometimes violent behavior. Khat. Khat is a plant native to East Africa and the Arabian Peninsula whose leaves contain stimulant compounds. Chewing khat can produce feelings of euphoria, increased energy, and improved focus, but it can also lead to dependence and health problems with long-term use. Cocaine. Cocaine is a powerful stimulant derived from the cocoa plant. It produces intense euphoria, increased energy, and heightened alertness by blocking the reuptake of certain neurotransmitters in the brain, but it is highly addictive and can cause serious health issues. Mephedrone. Mephedrone, also known as meow meow, is a synthetic stimulant chemically similar to amphetamines and cathinone. It can produce effects similar to MDMA and cocaine, including euphoria, increased energy, and heightened sociability. Heroin. Heroin is an illegal opioid drug synthesized from morphine, a natural substance extracted from the seed pod of certain varieties of poppy plants. It is highly addictive and can cause profound euphoria, sedation, and respiratory depression. Methamphetamine. Methamphetamine is a potent stimulant that affects the central nervous system. It produces intense euphoria, increased energy, and a sense of confidence, but chronic use can lead to addiction, cognitive impairment, and severe health problems. Ecstasy. Ecstasy, or MDMA, is a synthetic drug that combines stimulant and hallucinogenic properties. It produces feelings of euphoria, empathy, and heightened sensory perception, often used recreationally at parties or music festivals. Dimethyltryptamine. Dimethyltryptamine, DMT, is a powerful hallucinogenic compound found naturally in certain plants and animals. It can introduce profound spiritual experiences, visual and auditory hallucinations, and altered states of consciousness when ingested or smoked. Tobacco. Tobacco contains nicotine, a highly addictive stimulant. Smoking tobacco products can lead to nicotine dependence and numerous health problems, including lung cancer, heart disease, and respiratory disorders. Nitrous oxide. Nitrous oxide, also known as laughing gas, is a colorless, sweet-smelling gas commonly used for anesthesia and pain relief in medical settings. It can also produce euphoria and disorientation when inhaled recreationally. Cathinones. Cathinones are a class of synthetic stimulants chemically related to cathinone, a naturally occurring stimulant found in the khat plant. They can produce effects similar to amphetamines and MDMA, including increased energy and euphoria. Cannabis. Cannabis, also known as marijuana or weed, is a psychoactive plant containing THC and other cannabinoids. It can produce relaxation, euphoria, and altered sensory perception when smoked, vaporized, or ingested. Codeine. Codeine is an opioid medication used to treat pain and coughing. It is less potent than morphine, but can still cause drowsiness, euphoria, and respiratory depression, especially when misused. Salvia. Salvia divinorum is a psychoactive plant native to Mexico. When smoked or ingested, its active ingredient, salvinorin A, can produce intense hallucinations, dissociation, and altered perception of reality. NBOM. NBOM, or NBOMe, refers to a series of synthetic hallucinogenic drugs derived from the chemical compound 2C. They are often sold as substitutes for LSD or MDMA, but can cause severe and unpredictable reactions, including seizures and cardiac arrest. Gabapentin. Gabapentin is a prescription medication used to treat epilepsy, neuropathic pain, and other conditions. It can produce sedative effects and feelings of relaxation when abused, leading to dependence and withdrawal symptoms. GHB and GBL. Gamma-hydroxybutyrate, GHB, and gamma-butyrolactone, GBL, are central nervous system depressants with sedative and euphoric effects. They are sometimes abused as recreational drugs or as date rape drugs due to their ability to cause memory loss and unconsciousness. Methadone. Methadone is a synthetic opioid medication used to treat opioid addiction and manage pain. It helps reduce withdrawal symptoms and cravings, but can also be addictive and cause respiratory depression if misused. Methoxetamine, MXE. Methoxetamine is a dissociative drug similar to ketamine, but with longer-lasting effects. It can induce hallucinations, out-of-body experiences, and loss of motor control when ingested or snorted. Nicotine. Nicotine is a naturally occurring chemical found in tobacco plants. It is highly addictive and acts as a stimulant, increasing heart rate and blood pressure when consumed through smoking, vaping, or chewing tobacco products. New psychoactive substances. New psychoactive substances, NPS, are synthetic drugs designed to mimic the effects of traditional illicit drugs. They often bypass drug laws by constantly altering their chemical structure, posing serious health risks due to their unknown effects. 2-DPMP, desoxypipedrol. 2-DPMP is a stimulant drug chemically related to methylphenidate and amphetamines. It can also produce increased energy, alertness, and euphoria, but also carries a high risk of overdose and addiction. Ketamine. Ketamine is a dissociative anesthetic with hallucinogenic properties. It can induce sedation, anesthesia, and altered states of consciousness, often used in medical settings and as a recreational drug. Mescaline. Mescaline is a naturally occurring psychedelic compound found in certain cacti, notably peyote. It can produce visual hallucinations, altered sensory perception, and spiritual experiences when ingested. Morphine. Morphine is a potent opioid medication used to relieve severe pain. It produces feelings of euphoria, relaxation, and sedation, but can also cause respiratory depression and physical dependence. Pregabalin. Pregabalin is a prescription medication used to treat neuropathic pain, epilepsy, and anxiety disorders. It produces calming effects by modulating neurotransmitter activity in the brain, but can lead to dependence and withdrawal symptoms if misused. Synthetic cannabinoids. Synthetic cannabinoids are man-made chemicals designed to mimic the effects of THC, the active ingredient in cannabis. They are often sprayed onto plant material and sold as synthetic marijuana, but they can cause severe and unpredictable reactions. Tramadol. Tramadol is a synthetic opioid medication used to treat moderate to severe pain. It works by binding to opioid receptors in the brain to relieve pain, but can also cause drowsiness, dizziness, and respiratory depression, especially when misused.